beauties. I'm still your host, Kiana Gamble, and this next guest is super sweet. I'm excited to have her on. So without further ado, welcome Jennifer Prince. Enjoy, beauties. Well, welcome to the podcast. I'm so excited to have you on.
Well, thanks for having me. Yes, life's a little bit chaotic right now, but I'm happy to be here.
Well, I really appreciate you taking the time. I know you have to be so busy with everything going on, running your own practice, working, life, family, all of it.
Well, I'm excited that you're doing this. I think it's really valuable, in particular for newer injectors, to be able to hear, different stories on how to get into the industry, kind of trials and tribulations of, what we've learned throughout the years. And I think it's great. So kudos to you, darling.
Oh, thank you. Well, let's just jump right into it. I want you to kind of give us a brief overview of your story, your journey into the aesthetic industry, and then we can kind of tick off some of our questions.
Sure. So, my journey is a little bit different. I, started my career in nuclear medicine, and I began setting up nuclear cardiology labs around the country. And this was in early 2000s, and had moved from Nashville to Scottsdale, Arizona, where I reside now. And then the Sunshine Act was passed, where physicians can no longer self-refer for testing. So I didn't want to go back into the hospital. I was on a wait list for PA school and was told, hey, you can, get in immediately into a nursing program. And I really didn't want to be a nurse. I had no aspirations for being a bedside nurse, but I went ahead and did it because I was able to get in immediately and not have to take any prerequisites and so forth. So my journey as a new nurse, as I didn't want to work in a hospital, I applied for a plastic surgery physician as a post-op, pre-op kind of in-office nurse. And because of my background in medicine, he hired me. Now, this was back when fillers and, injectables was not a thing. There was no such thing as an aesthetic nurse at this time. And so if you told me that's what I'd be doing today, back when I started working for a plastic surgeon, I would have told you were insane, because it wasn't even anything that I aspired to do. However, I really did love working with patients in an outpatient setting. And I loved the connection that I built with the surgical patients. And so really quickly, as aesthetic medicine started growing, the surgeon asked me if I wanted to inject. And I said, I don't even know what it is, really. I don't feel like I'm equipped enough to know what to do. So I did a big box injector training program, and it was just a 3-day program, I think, at the time. And I remember calling him afterwards, and he said, and I was crying, and he said, okay, are you ready to start seeing patients? And I said, absolutely not. I feel scared. I feel like, I'm dangerous. And so from there, having had the background, the reason why I mentioned my background in nuclear medicine is because, when we're injecting a radioactive drug into the body, we're looking at the function of the organ. And so I really wanted to know, when we injected a dermal filler or a neuromodulator, what was happening inside the body. And so I called up Allergan at the time and requested, anyone that they had that was training. And so at the time, there were just a few trainers in the state. And so I trained with them, and I asked the same questions, and no one could answer some of the questions that I had. So I called higher ups, and I said, okay, I'm willing to travel. I'm not going to inject until I feel safe. So how do I get there? So I spent, the first few years of my career becoming obsessively training with different providers around the country, just trying to feel some sense of security. And I think, that's kind of how I got my start. I was only injecting maybe 2 or 3 years when Allergan came and said, hey, we'd love for you to be a trainer for us. And I said, I'm not really worthy of that. And they said, but Jen, you've spent all this money and you've traveled and you know so much. Like, there's nobody else that we would want to be training in the Valley. So I started training for Allergan and then eventually started training for Galderma as well, and to a couple different plastic surgeons throughout the years. And then back in 2018, made the jump to open my own practice in aesthetic training center. And that was not an easy kind of feat or leap. I was one of the first registered nurses to open her own practice, as well as one of the first that would be opening up a training center. So I think so many people said, I'm not qualified to train. And so that's when I spent, the past 4 years trying to get certified for my business and my accreditation for training, and so that I can prove that my training program is worthy of that accolade. And that's kind of where we are today.
How awesome. Very cool that you started in nuclear med and then, became a nurse, not really wanting to become a nurse for traditional reasons. And then, ending up where you are. That's very, very, very cool. Like, I like that you have a little bit of a different story. I do also want to highlight, it sounds like back when you had started kind of in the industry, it was a lot, not easier, but it seems like a lot more injectors started by, working under a plastic surgeon and kind of getting in that route. And I want to make the comment that it's a little bit different now, because I feel like that's ideally the way everyone would want to get into the industry. But unfortunately, there's just not the availability of jobs that way.
Sure. Yes. I mean, I was very lucky. I look back and think of, the people that helped me along the way, and I'm so grateful for that. However, I did not have anyone that I didn't have anyone that gave me education. Like, I had to pay for my own education. I remember that first year I was spending more in training myself than I actually made, when we can always talk about, money in this industry if you'd like. But you're right. There's so many people now that want to get into the industry. They actually go to nursing school just to be an injector. And, I think, even through the people that I train and I mentor through Institute of Aesthetics, my business, it can be difficult to get into the industry. However, if you're willing to do the work, it's not that difficult. I think sometimes it's hard because you may have to take, less pay, or you may have to work for free to shadow or maybe medical assist to get the training. But I do think, those people who go out there and really seek it and work hard tend to do well in the industry. That being said, I do think, there's a lot more people that are going through training and going straight into kind of being their own boss and doing that. Whereas back 10 years ago, 15 years ago, that was unheard of. So I do think that industry has changed significantly in that realm.
For sure. And I would love to touch a little bit on money, because I think that a big misconception is that you'll get into the industry and you make a bunch of money right off the bat. I mean, trainings are not cheap, and neither are, it takes a lot of time to build up clientele and get people that will stay with you and, become consistent clientele.
Absolutely. Yes. And I talk to new injectors about this all the time, because, it looks, gosh, I mean, we could talk for hours about this, but when people look at, an injector's life or what they do for a living, yes, I mean, from bedside nursing to working in aesthetics, it looks glamorous and it looks fun. And TikTok and Instagram can make it look something that it's not. The reality is, what I do, and the reason why I believe God's placed me in the position that I am, is to truly help women and men feel good about themselves. So there's a whole psychosocial aspect to what we do that can be overwhelming. I tell my husband, I'm like, I don't ever get to be off. I can't have an off day. I can't have a day where I don't give it everything. I'm working with people's faces and I have to be on all the time. So it can be emotionally draining and exhausting. That being said, sorry, I jumped off the subject here, but going back to money, I find people will come in and they think that they're going to make all this money. And I say, it takes, I think, about 2 years of full-time work in aesthetics to build a clientele. And I think that's being very generous. I think in some areas of the country, it can take longer than that. But I would say in Arizona, where I'm located, it takes about 2 years to start building a clientele. So, if you are changing jobs every 2 years, then you're going to lose a significant amount of those clients as you bounce around. So that's one thing to be considerate of. The other thing is if you don't have a clientele and you're a brand new injector, you can't expect to make the kind of money that someone who's tenured and has, a book of business would make. I go back to like my very first job in aesthetics. I made $25 an hour and no commission. And most people can't even live off of that today. And people will say, oh my gosh, why did you do that? And I said, because I didn't know what I was doing. Like, how could I go and say, oh, I deserve $40 or $60 or 50% commission or whatever everyone is asking for right now. So going back to when I talk to new injectors, I say, get a job, that job, and don't be picky about what job that is. If you have someone offering you something, even if it's minimum wage, for you to be able to get that experience is invaluable. And there's a cost to each patient. So every patient that you have the opportunity to put your hands on there's a value to that patient, and building that relationship with that patient that could be your patient for life. If you imagine how many thousands of dollars they're going to spend with you over their lifespan, that has value as well. So yes, I see people getting paid small amounts, large amounts, percentages off, cost percentages off, net, or gross versus net. I think it varies greatly in this industry.
100%. I'm glad that you touched on that. And I think you have really, really great advice. I kind of want to segue into, what is your advice for someone who's actually gotten into the industry and they're still very new though? It's still in that 1 to 2 year mark. What do you say to those injectors that are, they're looking for trainings now? They're looking to kind of perfect and better their craft.
So I think, everyone should have at least 1 or 2 cadaver classes under their belt. I think every time you do a training, you're going to get something out of it. So, I would say try to take, say, 10% of your earnings and spend, and that's such a small amount, 10%, but I would say take that and spend it in furthering your education. The great thing now that a newer injector has that I didn't have was all of the on-label indications that we have now. And so, I just did an Allergan training today and was able to teach 3 newer injectors how to use cannulas in, the cheeks, how to use cannulas in the chin, so things that we would never, that I would have had to pay private money for in the past, you can get through industry training. So definitely reach out to your reps, request the training from the reps, but also, if you have someone that you admire, say through social media or in your area, look for mentors. I think that is so invaluable. I get called by people I barely know to help them with complications every week. And I know some injectors will say, oh, like I would never, for legality purposes, I would never help someone because I don't want my name on their record. And for me, I'm like, thank you, God, that they felt that they could call me and that I would be that person to help them through that horrific situation. So I'm grateful for it. So I mentor the majority of this town and half the friggin' country. So always feel free to reach out to people.
That's great, because I feel like depending on who you talk to or who you reach out to, some people still have that mentality of, competition over community. But I love that you're, taking the knowledge that you do have and you're sharing it, and you're not being like, no, like, I'm just going to keep it to myself.
Yeah. I learned a long time ago that the industry is better. By raising the industry, the whole industry gets better. So it's not going to ever benefit me. If I can't, if my schedule's so far booked out that a patient cheats on me and goes down the street and they have a complication, like that's hurting that patient, that's hurting me, that's hurting the whole industry. So I think that single mindset, I feel like it's very rare to see that these days. I think a lot more injectors are really coming together as a tribe, and I love that. But I think the more you reach out to people, you'll find your tribe of people. And I think everyone should try to find like their own little group in their area or even outside of their area that they can have for questions or have you seen this? Or, just a support system is really valuable in this industry.
That's great advice. I do want to kind of talk about, you do a lot of training, you have your own training facility. There is a large artistic component to aesthetics. So my question for you is, when you're training injectors, they could be brand new, they could be semi-experienced. Do you feel like you have that eye to know that person's going to be a really good injector or maybe that person's not, doesn't really have the eye?
Yes. And I would love to tell you that I could make that eye, but you can't. And I do, I'm not going to know that. There's some great people out there, Titan Aesthetics, and that does kind of some background work on personality testing and testing to see if you have the eye before they train you and sort of things like that. I don't do that because I feel like everyone has the right to make the choices for their life. And I feel like with hard work, anything is possible. That being said, I do think that those of us who have more of an artistic sense to us, like I've always been an artist. I've always, from the little time I was a little girl, I was drawing and painting and songwriting and doing. So I'm more of an artist in that standpoint. My brain just works more that way. I feel like those individuals can see asymmetries and things like that. But when I do a new injector training, we actually spend a long time at just looking for asymmetries. And sometimes you don't have to be an artist. I find sometimes the people that are best at aesthetics are really analytical and like their puzzle skills. So if they can kind of see, if they put together puzzles or they're good at Tetris or they're good at some of those kind of things, it's kind of awkward to say it out loud like that, but they can kind of see some of the asymmetries of the face and volume deprivations that would assist them in, revolumizing certain areas that maybe some other people don't see.
Actually very cool to not only see an artistic component, but more of an analytical component too.
Yes, I think they kind of both go hand in hand.
For sure. Very cool. So do you train on other modalities as well besides, neuromodulator and filler? Like, are you guys doing Sculptra, Radius, threads, anything like that at your practice?
Great question. So yes, I've been training Sculptra for probably 6 or 8 years now. So we now have a new indication through Galderma so that Galderma can pay me to train instead of people having to pay me privately. I don't do Radius in my practice nor threads. And again, I could speak to it if you would like for me to as to why I don't. I would say I'm just very safe. So for me, especially owning my own practice and training newer injectors, everything that I do in my practice, I want to make sure that I have the ability to use complication management, dissolve if I need to, treat if I need to. So I no longer do some high kind of danger zone areas like I won't inject noses or glabellas anymore. I just prefer to be able to sleep at night.
Fair.
anyway, we could get into that talk if you wanted me to talk about like collagen and production and things like that, if you like. But I do a ton of Sculptra. Actually, Sculptra, I would say, is my favorite thing that I do. And I would love to do a new study. I've got a lot of clinical data on Sculptra for acne scarring. And if you've ever worked with a patient that has really bad acne, ice pick scarring, and just the trauma it causes them, the fact that, we have a treatment there that could, change their life and their skin and really works. I'm just really passionate about that. So I'm doing a lot of clinical studies on that right now.
Very cool. Yeah, I would love for you to chat a little bit more on Sculptra, just because I don't think anyone yet has touched on, we focus a lot on Botox and filler, but I think that, there are so many other modalities within the aesthetic space. So I think it'd be really good to chat a little bit about Sculptra.
Yes. So Sculptra, poly-L-lactic acid, it's a biostimulator. It is not a filler. As we age, we lose 1% of the collagen in our bodies from, say, 20 years old forward. So I'm 44. I hate to say that out loud, but I am. So I've lost, roughly 25% of the collagen in my face, although really I haven't, because I do tons of Sculptra. But in general, so what are we looking at? So in this, and going back to like why I prefer Sculptra over, say, threads or radius or something like that, is really because I'm a complete nerd. Okay. Now, when we're looking at types of collagen is not all the same. Okay. I'm going to take this back to any of you guys that are maybe listening that has a breast implant. Okay. You place a breast implant in the body, and the body's going to produce a capsule around that implant. It's a thick tissue of scarring that actually protects the body from the implant from the body. Okay. Technically, you could say that that's made of collagen. However, that's not the kind of collagen that we want in our face. So the reason why I love Sculptra and the reason why I feel so comfortable with Sculptra is that Sculptra upregulates type 1 collagen. There are going to be plastic surgeons, and I've heard that it's so many times out there that, it's not the kind of collagen that we normally have in our body. And we have clinical studies that show that it actually is. So it's going to upregulate your own collagen, type 1 collagen, which is what we want. Now, other modalities, and I'm not going to talk ill of anything else other than to say, just do your research and see what kind of collagen fibers are formed by other things. They're not all the same. So if we're looking for, someone who has an animation line, like an accordion line, a round or smile line, if we're looking for someone who has like facial wasting or gauntness in the lower face, someone who has volume loss in the temples or preauricular space, someone who needs support in the deep medial fat pad of the chin, all of those areas can be treated with Sculptra by building collagen, thickening the tissue, helping with fine lines and wrinkles, like I spoke about earlier, helping with acne scarring by placing it and subsizing those acne scars and coming a little more superficial with a higher dilution. So if you can't tell, I'm passionate about Sculptra. Well, I am. So it's really life-changing. And those people that we've seen that have just aged backwards, and you're like, wow, their skin looks beautiful. Their pore size is small. Their skin is tight and luscious, and they don't have a lot of animation, folds, or wrinkles on the face, and yet they're 60 years old. What have they done? It's Sculptra. It may be filler too. They may have some filler in there for some volumization in like the framework of their face or areas like that. But in general, it's Sculptra. So yeah, hopefully that helped some of you guys out there. If you're on the fence about carrying Sculptra in your practice, it will fill a void that you just can't fill with regular filler alone. And now you have a way to offer it with doing on-label training through your BDMs without having to pay for it. So that's really great as well.
That's awesome. We love Sculptra here too. So my question for you then is, someone who's 1 to 3 years in the industry, when do you think it's appropriate to kind of integrate other modalities like Sculptra into their practice? Just because, there's so many techniques and so much to learn with just neurotoxin and filler alone. When do you think it's appropriate for someone to branch out into other modalities?
I usually say that 2 to 3 year mark is when you're finally getting that hand-eye coordination, the dexterity of pushing fillers. I feel like at that point you're looking for more. And that more might be a different treatment area. Maybe you want to learn how to do, a temple augmentation or a jawline augmentation or something that you haven't done previously. But I think that is a point in time where you can jump into the Sculptra realm. I don't like new injectors using Sculptra, like if you're a brand new injector, only because of the push of it. It is like water. So if you're not really comfortable with your cannula technique or your needle techniques yet, if you're still kind of working on depth of tissue planes, I don't think it's probably right for you. But I think once you're at that 2-year mark, you're probably pretty comfortable with those areas. And if not, then that's when I think, going and taking a cadaver class and then just some self-study is really valuable. So I think that's one of the things that I see a lot of issues with newer injectors is just how to know where you are in the tissue and, complications that could arise with that.
Great advice. And then I just want to ask you, are you a registered nurse or do you have your advanced practice degree?
I'm a registered nurse. I actually just got accepted into Vanderbilt University's accelerated NP program. So I start in August and it's a 1-year program. So I'm really nervous about that because most programs are part-time and are 2 to 3 years. So this is going to be a little crazy, but I'm going to do it. So I'm excited. So I have 2 different bachelor's degrees, one in nuclear medicine and one in nursing. And so this will be my MSN program that I start in August.
How exciting. So that was kind of my question for you is with most of aesthetics, more and more is coming on label, but a lot of the things that aesthetics is off label. Do you have issues being a nurse in even owning your own practice and, creating this Institute of Aesthetics? Do you find more barriers with just being a registered nurse versus having your advanced practice degree?
I think it depends on the state of which you live. So I live in Arizona. It's kind of, the Wild West out here. There are, as an advanced practice nurse, you can stand alone. You don't need to have a medical director. You can be your own medical director. You can own your own practice. You have full prescribing rights. You don't have to work under a physician. As a registered nurse in the state of Arizona, I can own my own practice. However, I have to have a medical director that is within 4 hours of a phone call. So it's not even that they have to be on site. If I were doing a lot of heavy like CO2 lasers and things like that, they would have to be. However, for injectables, I just have to have someone who is a phone call away. So my medical director is Dr. Keith Marcus. He is a facial plastic surgeon. He has a place in Manhattan Beach and Redondo Beach. And he and I both train together. So we do a lot of podium stuff together. And so I'm very blessed to know him. He's my mentor and has taught me so much in aesthetics. And so there's kind of a big disconnect right now with a lot of dermatologists not really wanting, nurses to, or even, mid-level providers to be able to inject. But then there really is a lot of people out there like Dr. Marcus who is super supportive of nurses as well as NPs or PAs injecting. And so I think you just have to, again, find that person that you connect with that can be your support system. But definitely, for me, I just want for me to be training other providers to always excel in education. I just needed to be able to do that as well. And that's why I'm going back for my advanced practice. I think there's going to be a time in the future that we may need it. I think that's way far in the future. I hope that never comes to fruition, but that's why I'm moving forward.
Awesome. I did not realize that was who your medical director was. I've taken a few classes from him virtually.
Yeah, he's great. He's really like one of the best humans I know.
Very cool. And so I do want to give you an opportunity to kind of talk about the Institute of Aesthetics and just kind of the programs that you do offer for those that are interested in coming to see you.
Sure. So like I said, I'm located in Scottsdale, Arizona. My company is called Institute of Aesthetics, Beauty and Wellness. We are a part medical wellness center. I don't use the word med spa because I think it cheapens our brand. However, we are a part medical wellness center because we provide wellness and beauty, as well as part aesthetic training center. So I am an accredited facility for new injector immersion training. That has taken someone that has never held a needle before and giving them credentialing and certification, continuing education credits as well. My 2-day course offers 20 hours of aesthetic education with hands-on training as well as didactic. We do neuromodulators and dermal fillers, and they are cannula trained during that time as well. I do also offer, like Dr. Marcus and I do foundations of anatomy. We try to do a few of those courses each year. I do advanced off-label training such as temples, tear troughs, Sculptra, cannulas, neck, and body. So that is my center. And I have 2 nurse practitioners that inject in the practice along beside me. We have medical estheticians, and we're just a little family of people trying to better the world of aesthetics.
And what is the best way to reach out to you, find you on social media, that kind of thing?
Sure. So my personal business Instagram is Jennifer_Prince_aesthetics. And my business Instagram is at Institute of Aesthetics. For training opportunities or training inquiries, you can visit my website at instituteofaesthetics.com. And our email is info@instituteofaesthetics.com.
Well, perfect. Thank you so much for taking the time, Jennifer, coming on today.
Yeah, thanks for having me. It was my pleasure, and I hope to see you soon.
All right, beauties, that was season 2, episode 3. Great episode with Jennifer Prince. Again, thank you so much to Jennifer for taking the time to chat with me. In other news, if you have yet to try Pro Lash, which is at-home lash extensions, they last up to 10 days. They are the perfect in-between with the strip lash and committing to lash extensions. They're amazing. You can take them off after so many days, rub your eyes. That's my favorite thing to do. I know it's a no-no, but still, favorite thing. So, if you're interested in trying Pro Lash, use my code at checkout, Kiana10. If you have not already checked out the new apparel on my website, aestheticnursekiki.com, go and check out the cute Hello Beauty sweatshirts I just launched. They are the softest, cutest, they're beige. I'm obsessed with them, so go check those out. And if you are not following the podcast Instagram as of yet, go follow us to find out the latest episodes that are dropping with the latest speakers. That is at aesthetic.chatwithkiki. My personal aesthetic Instagram is at aestheticnurse.kiki. So there you'll find educational posts and info on my upcoming event. If you are in the Pacific Northwest, we would love to have you at my first ever in-person event, which is called Brunch and Aesthetic Chat. It is held in Coeur d'Alene, Idaho. We have a live podcast episode with Melissa Berg. There's also going to be a Q&A panel. We're going to have representatives from Skin Better and ZO, as well as Galderma and Allergan reps. So we would love to have you there. Go check out all the details on my website, aestheticnursekiki.com. All right, beauties, that was episode 3. I will see you on the next episode. Bye.